If you have a sick child, you may be very stressed out, and when we're under stress, sometimes we don't think straight, and we can make mistakes when giving our children medication. A recent study shows that 80% of children who end up with Tylenol overdoses in the emergency room happened because of unsupervised ingestion, but that means that 20% of the time it may have been the parent who gave the child too much medication. It's very important to know what medication you're giving, how often it should be given, and what the proper dose is before administering it. And if you ever have any questions about it, call your child's doctor first before giving it. Don't guess, and be sure to follow the instructions that your doctor gives you exactly. If your child is under the age of 2 and you're thinking about giving an over-the-counter pain reliever, call the pediatrician's office first, and they'll give you information about whether or not you should give it and how much and how often it should be given, if they feel like it's necessary. If your child is over the age of 2 and you decide to purchase over-the-counter pain relievers and administer it to your child, there's a chart on the back of it that will tell you how much the child should be given based on their age and weight. And again, this should be followed exactly. For example, if the chart tells you that you should give your child a teaspoon of medication based on their age and weight, you shouldn't use a regular spoon to administer that because you might be giving your child too much or too little. Be sure to use the advice that came with the medication when you purchased it. Sometimes this is a cup and sometimes it's a syringe. Another important thing to pay attention to is the frequency that the medication can be given. Sometimes this is how parents overdose their children because they're giving them too much in a 24-hour period. So be sure to follow the recommendations on the medication insert or the instructions that your pediatrician gave you if they gave you specific instructions for your child. One more thing to consider is that if your child spits the medication out or throws it up after you give it, you should not give them more medication to compensate for that, because you might be overdosing them. More may have stayed in their system than what you thought, and that could also cause problems. Again, at the end of it all, if you have questions about it, always call your pediatrician and they'll be able to give you specific information and advice. And if you have more questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.